Hello everyone, my name is Divanshu. Welcome to the channel GDC English. In this video, we're going to learn the enzyme inhibition, which is very much important for you guys to learn and understood the concept behind it. Okay, because everyone just remember or learn the things whether Kmax was increasing, Vmax are increasing, both are going down. But what is the reason behind it? What is the concept behind it? So in this video, we're going to have to learn or make to understand that concept behind why Kmax is increasing, Vmax is decreasing, and all the other things. Okay, and this topic is very much important for you because direct questions may arise from this topic. Okay, so let's start. First, we will see the enzyme inhibition. What is enzyme inhibition? Enzyme inhibition. Okay, so enzyme inhibition is just like the complete or partial loss of enzymatic enzymatic activity by binding of drug. See, drug can be act through non-receptor mediated as well as receptor mediated. So enzyme inhibition is one of a kind of non-receptor mediation drug response. Okay, so many of the drugs act through enzyme also. For example, ACH is drug. ACH is metabolized by the acetylcholinesterase acetylcholinesterase, but there are drugs, some drugs also which inhibit the acetylcholinesterase enzyme. Those drugs are anticholinesterase. For example, physostigmine, neostigmine, rivastigmine. No, so these are the drugs which inhibit the enzyme, which are particularly responsible for the inhibition of acetylcholine. Okay, so there we have three types of inhibition. First one is competitive inhibition. Competitive inhibition. Second one is non-competitive inhibition. Inhibition. And third one is uncompetitive inhibition. Okay. So there are three types of inhibition which generally takes place, whereas uncompetitive is one of the rare one which can be implemented. Okay. So let's talk about the competitive inhibition. What is competitive inhibition? So as this word signifies that it is a competitive in nature. No. So there must be some competition. All right. So there must be some competition. Yes. So there is a competition. Between whom? Between a substrate. Between a substrate which seems to be like this. Okay. And a inhibitor which seems to be like this also. And where do they bind? Where do they bind? They will bind onto the enzyme. They will bind onto the enzyme. Right? So this is the structure of substrate and the inhibitor. That is inhibitor drug. Inhibitory drug. Here, in competitive inhibition, the substrate as well as the inhibitor would have similar structure. Would have similar structure. First point, that it do have a similar structure between substrate as well as inhibitory drug. And there is a competition between both of them. And there is a competition between both of them. First one is substrate and second one is inhibitory drug. See, both the drugs have similar structure to bind this site. What does this site may called? This site is called as active site, right? So this inhibitory drug will compete against this substrate one. One of the compound would have bind to the enzyme, all right, but at the low concentration of substrate, this inhibitor will be won. This inhibitor will won this competition. After that, there will be an enzyme substrate competition. If there is no inhibitor, what will happen? There will be a enzyme substrate complex, ES complex, which ultimately makes a response after that, that is product, that is response. Okay, that is response. So here the inhibitory drug would have similar structure of what? Of substrate. And this inhibitory drug would only compete for the active site. Second point, the inhibitory drug compete with substrate for active site. Okay. Now, what will happen? There is a term called as Km, and there is a term called as Vmax. What does this signify? Km means the affinity or the substrate or the amount of substrate that is required to make enzymatic activity or to show enzymatic activity or to show oh, show enzymatic activity, isn't it? Whereas Vmax is an enzymatic activity. Okay, so there is a concept, two terms, Km and Vmax. So what will happen in the case of competitive inhibition? What will happen? See, here if we talk about the enzyme and the substrate is going to bind on the enzyme only if there is no inhibitor. But once if the inhibitor is in between the competition against substrate, what will happen? The substrate will have no chance to bind onto the enzyme. So what will happen? Then if the concentration or the dosage of the substrate would have increased, if the substrate dosage or concentration would have increased, it will replace the position of inhibitor onto the enzyme site. That is, it is surmountable. It is surmountable if we have increased the dosage or concentration of substrate or the drug. Then it will replace the inhibitory drug from the enzymatic position, active site. Okay, so inhibitory drug would have target only the active site. That's it. Okay, so now if inhibitory drug has attached onto the enzyme, then the amount of substrate would be increased. No, amount of substrate would be needed highly. High amount of substrate would be needed to replace the position of inhibitory drug. Yes, so that means Km would be increased. Correct. Increased amount of substrate is needed to replace that drug. This means Km is increased. Now this inhibitory drug is going to bind onto the enzyme. What will happen? The enzymatic activity would be constant, not decreased. Would be constant because enzymatic activity will be shown. Why? Whenever the substrate is going to bind onto the enzyme, then only the enzyme activity will be shown, isn't it? That's why Vmax will be same. Correct? Yes. Vmax will be same. Now let's talk about the non-competitive inhibition. Non-competitive inhibition. What do we happen here? So same thing. Enzyme There is a substrate, there is an enzyme, and there is a drug or inhibitor. There is a inhibitor and there is a substrate, isn't it? Here, the substrate binds onto the active site. That is right. That is right. Bind onto the active site and forms a complex, that is E plus X complex, and will form a product and show response. Form a product and show a response. Correct? Now, what will happen? This inhibitory drug in non-competitive inhibition will bind not onto the active site. This will not bind to the active site. No, this will not bind to the active site, but it will bind to the allosteric site. This is in This site is known as the allosteric site. This is an allosteric site where inhibitory drug bounds except the active site. It will bound to the active site. Which one? The substrate will bound to the active site. This is an active site. But inhibitory drug will bound onto the allosteric site, as well as it has the capacity to bind onto the ES complex as well. So inhibitory drug inhibitory drug can bind onto the enzyme plus E plus X complex on both the sides. On both the areas, the inhibitory drug can be bound and show the non-competitive inhibition. Non-competitive inhibition. All right. So what will happen over here? What will happen over here? There is that Vmax will be decrease and and the and what? And the Km would be same. Correct? How? Here, whether it doesn't matter how much amount of substrate you are going to give onto the enzyme. It doesn't matter how much you will give the substrate to the enzyme. It doesn't matter. But still, the enzymatic activity would be down. Why? Because the inhibitor will here binding onto the allosteric side. That's why it is lowering the enzymatic activity. Since see in the previous one, the enzyme the enzyme inhibitor is binding or competing onto the active site only. That's why Vmax was not lifted or decreased. Vmax was not affected. But here, when the substrate is binding, so it will show some enzymatic activity. Correct? It will show some enzymatic activity. But here, inhibitory is decreasing the enzymatic activity. Correct? Because in substrate is already bound towards the enzyme. That's why Vmax is being decreased. And Km is, that is Michaelis-Menten constant, is going to be the same because there is no enzymatic activity would be seen because of the substrate. Substrate is how much ever you bind the substrate onto the enzyme, it doesn't matter. The Vmax will be the now. Okay. Chalo. Next one is uncompetitive. Uncompetitive inhibition. In uncompetitive inhibition, what is happening over here? The substrate. This is a substrate, and there is a enzyme, and there is an inhibitory drug again. Inhibitory drug again. Okay, okay. Inhibitory drug again. Now, what is happening here? Here, the enzyme will bound substrate onto the active site. It will bound over here. It will bound over here. The substrate and enzyme. Substrate and enzyme. There is an enzyme substrate complex. But the inhibitory drug would not bind to the enzyme over here. No, it will not bind over it. But the inhibitory will just bind onto the this side, and ultimately leading what? It is again leading what? Decrease Km and decrease Vmax. Okay, there is a decrease amount of Km and decrease Vmax. Why? Because they ultimately again the enzymatic activity is being decreased. How? The substrate is bound onto the enzyme. Substrate is bound to the enzyme, but still the inhibitory drug is bounding onto the ES complex, and that's why it is lowering down the enzymatic activity. And what about Km? Km is the amount of substrate. So amount of substrate is not needed much. There is less amount of substrate needed to produce the enzymatic activity because it is already there. This inhibitory drug is not going to counteract between the substrate and enzyme over here. That's why substrate in the normal dosage will automatically show the enzymatic activity. So there is less amount of Km required, that is amount of substrate required. Also, the meaning of Km over here is the meaning of Km over here is inversely proportional. Km is inversely proportional to affinity over here. Km is inversely proportional to affinity. So here you can see that inhibitory drug is going to compete against the substrate with the enzyme for the active site of enzyme. So the affinity of substrate would be decreased. Since I have told you that affinity of the substrate is inversely proportional to the Km. So Km would be what? Km would be increased. All right. So there is another relationship between affinity and the K. Okay. All right. Chalo. Next, non-competitive inhibition. Here, what was happening? The Km remains the same. Why? Because the affinity is doesn't matter. Because affinity also doesn't matter. Because the substrate is going to bind, but still the how much amount of substrate you give, it doesn't matter because it will not be able to produce any enzymatic effect. All right. But if we talk about the uncompetitive inhibition, substrate is quite having much affinity against the enzyme. Correct? Substrate is having a lot of affinity against enzyme because there is no counteraction of inhibitory drug over here. That's why affinity is high, and affinity since is high, the Km would be low. All right. So this is all about the concept of competitive inhibition, non-competitive inhibition, and uncompetitive inhibition. So these are the things which you have in your mind. Behind this Km and Vmax, Km is Michaelis-Menten constant and Vmax is the enzymatic activity. All right. So let's make a table of it also. Final table, final table, important, which is an important one. Important table. See, in competitive inhibition, this will bind onto the enzyme only. Inhibitory drug will bind onto the enzyme only. That is active site. Active site. And what will happening? What was happening at that time? The Km would be increased and Vmax remains the same, isn't it? Now, non-competitive. In non-competitive, the inhibitory drug was binding onto the E and ES complex, isn't it? And here what was there? The Km was same and the Vmax was decreased. Correct? Also, if we talk about the uncompetitive one, uncompetitive, it was binding onto the ES complex only. The drug was binding onto the ES complex only, and both Km and Vmax was decreasing. Okay, so this is the table that you have to learn, and why they are altering. Km is increasing, Vmax is decreasing. Now you have got the concept behind it. Okay, so let's start with some MCQs to strengthen your concept. So, which of the following statement is true about competitive inhibition? Which of the following statement is true about competitive inhibition? Vmax decreases, Km remains unchanged. Okay. Vmax unchanged, Km increased. Okay. Both Vmax and Km decrease. Okay. Both Vmax and Km increase. Okay. So you have 5 seconds to answer. Please answer. Chalo. See, in competitive inhibition, what was happening at that time? In competitive inhibition, the 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 inhibitory drug was in competition with the substrate for the active site of enzyme. So there was less affinity of substrate and more amount of Km would be needed. So more amount of Km would be needed means the Km is increased. So in which option Km is increased? Yes. Here you go. The Km is increased. And what was happening at that time? The Vmax remains unchanged. So B option would be your right one. Nice. Shallow. Yes. B option is right. Which of the following inhibits binds to the enzyme substrate complex but not to the free enzyme? Okay. Competitive inhibitor, uncompetitive inhibitor, non-competitive inhibitor, or both A and B? 5 seconds to answer. Okay. So I have told you that in uncompetitive inhibitor, the enzyme substrate complex is bound to the inhibitor, but not to the free enzyme. Okay. So uncompetitive would be your right answer. Sure. Uncommon. Yes. Which of the following statement about Michaelis Menten constant is true? Km is true. Km is the concentration of drug required to achieve Vmax. Km is inversely proportional to the enzyme affinity for the substrate. High Km means high affinity. Km has no relation with enzyme affinity. Okay. 5 seconds to answer. So yes, Km is inversely proportional to the enzyme affinity for the substrate. Km is the inversely proportional. Okay, that is one of the relation behind Km and affinity. So yes, in non-competitive inhibition, it can be overcome by adding excess substrate. Inhibitor binds to active site only. Vmax decreases and Km remains the same. Both Km and Vmax decrease. Okay, 5 seconds to answer. In non-competitive inhibition, what was happening? See, this one is for competitive one. This one is for competitive inhibition. Inhibitor binds to the active site only. That is also for competitive inhibition. No? Competitive inhibition. Vmax decreases and Km remains the same. Yes, non-competitive, we do have Km remains the same and Vmax decreases. Both Km and Vmax, this is for uncompetitive inhibition. Okay? So yes, Vmax decreases, Km remains the same. So this is all about the video in which we have discussed the enzyme inhibition. That is a very much important part for your general pharmacology and in somewhat biochemistry also. So I hope I have made you clear about this concept and make you understand over here. So until then, take care of yourself and keep grinding yourself. Thank you.